Hello, everyone, and thank you for joining us for the second Health Reform Beyond the Basics COVID-19 Town Hall. We hope you're all doing well and staying safe. My name is Ina Rubin, and Beyond the Basics is a project of the Center on Budget and Policy Priorities. It's designed to provide training and resources to facilitate enrollment in the health insurance marketplace and Medicaid. We are a nonprofit policy organization and are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This town hall is not intended for press purposes. After the town hall, we'll circulate the slides and some additional resources. All participants are currently muted and in listen-only mode. If you'd like to ask a question, click on the Q&A icon and type your question into the box. We'll be taking questions during the second half of the town hall. We may not be able to answer every question asked, but we will have a record of all of your questions and we'll use them as a guide for future resources and presentations. You can also email your questions during and after the town hall to beyondthebasics@cbpp.org. This town hall will be an open forum for questions about eligibility and enrollment in marketplace coverage in light of the COVID-19 pandemic and recent federal legislation meant to address it. We'll begin the town hall with presentations from Sarah Lueck and Tara Straw, who will cover some important updates on eligibility and enrollment issues. They will also answer frequently asked questions about SEPs, COBRA, and estimating income. Now I'll turn it over to Tara Straw, Senior Policy Analyst here at the Center on Budget and Policy Priorities, to begin the presentation.
Great, thank you, Ina. Next slide, please. We're going to talk about unemployment insurance. This is one of the trickiest aspects of helping people right now because so many people have unemployment, and we know that there was federal legislation that changed the way for some people that unemployment is counted for the purpose of Medicaid eligibility determinations. So just to do a quick review of unemployment insurance and how it counts for APTC and Medicaid determinations. There are several components to look at with unemployment. The first is the weekly base unemployment insurance, UI. Second, there is, with federal legislation, an extension of UI for up to 39 weeks. Third, there's an expansion of UI to new population. So this is to people who are gig workers, who are self-employed, and who otherwise previously would not have been eligible for unemployment. And then there's a $600 per week federal supplemental UI that ends July 31st. So when you combine all of these things, it can be a substantial amount of income, and we want to make sure that we're counting it correctly for the purpose of APTC and Medicaid determinations. Now, all of those things are going to be included in the APTC determination, since that's based on annual income. But there's a special rule that applies for Medicaid determinations, which allows us to exclude the $600 per week federal supplemental UI. And so that means that more people will be determined eligible for Medicaid, even if they had substantial UI. Next slide. So we're going to do this through an example. We have Jane. Jane is single. She lives in a state that expanded Medicaid. Jane earned $12,500 prior to April 1st when she lost her job. She files for unemployment, and then we find out these key things about her. She has a base benefit of $375 per week. She gets an additional $600 per week in UI until July 31st, 2020. And we're going to say that she anticipates getting UI for 39 weeks. So the first thing that we always do is we do the Medicaid analysis. So Medicaid looks at income on a monthly basis. What is the current month's income? And for the purpose, for our purposes, it's going to exclude the $600 per week UI bump. So we're looking at a base benefit of $375 a week times 4.33 to get us to a monthly income. And that's going to be a little over $1,600, which puts her out of the Medicaid eligibility limits. Because she's not eligible for Medicaid, then we're going to look at her eligibility for APTC. So she has, we're going to look at her annual income, which is this time going to include the $600 per week in UI benefits until July 31st. So we're going to take her previous income, all of the other income that she has that's not UI. We're going to all lump that together, and it's going to be $12,500. Then we're going to look at her base UI across the 39 weeks that she said that she wants, that she expects to get it. And then we'll look at her bonus UI, and we'll only look at that in weeks up to July 31st. So you put all of that together, and she has income at around 300% of the federal poverty line. Next slide. So the question is, how do you do this in healthcare.gov? So we got you up to that last point in our last town hall when we said, okay, here's what the math looks like, and here's how to make sure that you know how to do it. But what we didn't say and couldn't say at the time was, okay, so how do you make sure healthcare.gov does this? Because we didn't know, and I think maybe at that point healthcare.gov didn't know how they were going to actually do this. But now we have a little bit more information that we want to share with you. So we're going to look at some healthcare.gov screens. So Jane, we're going to enter her unemployment income. Remember that here you've got to really follow the prompts on the screen to get the right determinations, right? So we're looking for the income that Jane currently gets this month, so only this month. So as we enter current monthly income, keep a couple of things in mind. So first, if someone received UI for the entire month, you're going to enter that on a weekly or monthly basis. If someone got only a partial month of UI, then you could enter that as a monthly amount. And enter lump sum UI as a one-time payment if it's received in that month. And that might come up for a lot of people if they've had delays. Maybe they became unemployed in April and they had a delay in getting their benefit, and then they get a lump sum benefit. We just want to be careful how we account for that so we have the right income going forward. Now, we said that there was an exclusion of the $600 per week. So how do you do that? Well, the system is going to do that for you. So you can enter in the full amount of UI, and then the $600 per week federal UI benefit is going to be excluded on the back end of the system for the Medicaid calculation. And this happens for any of those amount categories except for income that is noted as one time only. So if you have income that you're entering as a lump sum income, then just be careful, because that subtraction of the $600 per week isn't going to occur when you say it's lump sum income. Next slide. Okay, now for the most part, we're talking about the new application. And those of you who are experienced assisters will know what I mean when I'm saying new application versus old application. But here there is a little bit of a difference because the new application will list the expected monthly income calculation to include the $600 per week. And so you can see here for Jane, that's her entire $975 a week times 4.33. And like we said, that amount's going to be excluded on the back end to determine her Medicaid eligibility. We know here she's not Medicaid eligible. On the old app, though, that math doesn't work out quite the same, and this should show the correct amount for the Medicaid determination with the $600 per week already excluded. But no matter what you're seeing on the screen, remember it's the eligibility determination notice that's going to display the correct Medicaid monthly income. And so whatever your screen says, make sure that the EDN is correct. Next, please. Okay, so let's continue on with Jane. So what you'll note when they calculate the expected yearly income is that UI automatically calculates for 52 weeks. This is a problem that predates COVID. They've always had this issue with UI, even though it asks you whether it asks you for an end date For the UI, it actually doesn't use that date. It calculates for the whole 52 weeks anyway, and it doesn't have a start date, so it would know anyway when how many weeks you're going to have. Now, we understand that this is something that is going to be fixed, so when you do enter in an end date, that the system will start to recognize that as an end date. But as of now, you still have to be aware that you'll need to make an adjustment to the annual income to make it correct, to account for the fact that they have overestimated UI. Also, very important to remember to add the income that didn't occur during the current month. So you'll want to make sure to include Jane's prior wages, and you'll also want to include other types of income. I'm thinking in particular of the types of income that people may not have on an annual basis, but that might have in a time like this when people have lost their jobs and they have a lot of income cash flow disruption. So things like taking money out of an IRA or cashing out a retirement plan. These are taxable events, and this income, it needs to be included in their annual income. So you'd want to make sure to include the income here. And you can see where I've circled in red that you can get help estimating income, and that will bring you up to a screen that has that allows you to enter in monthly amounts. Next slide. So that's what we've done here for Jane, is we've entered in the income that she would receive in each month based on her prior income from January to March, her UI before July 31st, which includes the $600 per week extra, and her UI after July 31st, which includes just the base amount. And then healthcare.gov will add all of that up to get us a final income estimate. Next slide. So then we get back to the screen where it gives our expected monthly income. Now, again, it's another one of those screens where what you're seeing isn't quite what's happening. The Medicaid determination is not going to be based on this income amount. This is the income that was arrived at just by taking the annual income that you just entered in and dividing by 12. But this is not what the Medicaid determination is going to be based on, so don't worry about that. Just make sure the annual income is correct. And if the annual income is correct here, then as we'll see on the next slide, Kyle, next slide, please. Then we'll get back to a calculation of current monthly income. That is the amount that you entered to begin with. So you just need to ignore that screen in the middle that's based on the annual income. Easy enough. So this is the review screen before you sign and submit. And on this screen, you should double check the current monthly income. Like I said, it's reverted back to what you initially entered. And this is the amount that's going to determine Medicaid income after the system subtracts the $600 per week of federal UI. So again, you're seeing the amount that you would see for the APTC determination. You're not seeing the amount that you'll see for the Medicaid determination. And make sure the expected yearly income is correct on this screen. And I think that might be our last slide. Kyle, can you, next slide, please? Okay, and with that, I want to introduce my colleague, Sarah Lueck, who's going to talk about special enrollment periods in COBRA.
Hi, everybody. Great to be with you here today. Kyle, you can go ahead and advance it. So as I think you all know, a number of the state-based marketplaces did provide a special kind of emergency special enrollment period related to the COVID pandemic, which in a number of states is still available. But for healthcare.gov states that most of you are working in, that is not the case. So I think we just wanted to point out that probably the best place to look for opportunities is a few of the existing special enrollment period triggers that already are there for healthcare.gov, which you are probably well familiar with. But just to highlight a few that we think are probably most relevant at this time or that most people might be seeking. So the main one is loss of other qualifying coverage. Of course, when people are losing their jobs and they've had employer health benefits, this is really the one to go to try to make sure that they get coverage within the marketplace. So the loss of other qualifying coverage, it includes employer health plan, when you lose it because your work hours were reduced, when you lose it because you quit or were fired or laid off. Those are all situations when, if you lost your health plan from your job, you can get a SEP in the marketplace. Also, loss of Medicaid or children's health insurance or a student health plan can all qualify someone for an SEP under loss of other qualifying coverage or loss of minimum essential coverage for the technical term. And really a number of different situations when the insurer or the employer terminates or cancels somebody's health plan. So for example, if an employer was no longer paying premiums and a health plan ended up getting canceled, that would be another example of loss of qualifying coverage. Loss of coverage does not include situations where the enrollee voluntarily terminates or cancels their health insurance plan or just stops paying their premiums. Those would not be considered loss of coverage, triggering an SEP in the marketplace. Another situation that folks might be seeing right now is changes to employer contributions or benefits that do trigger an SEP in the marketplace. So this is when someone is enrolled in their employer plan and they become newly eligible for premium tax credits, as well as potentially cost sharing reduction. So these would be situations where an employer perhaps reduces what it is contributing to the health plan, or the enrollee's income drops and the plan is no longer affordable to them. If the employer cuts back benefits that are available under the plan, for example, raises the cost sharing or changes certain things about what's covered under the plan, it may no longer meet the test for being comprehensive under the federal government's definition, and that could create eligibility for premium tax credits for the worker that has been in that plan. And an important caveat here is that employers decide often with the insurer the terms of the coverage. So in these sorts of cases, the enrollee actually has to be able to terminate the employer coverage in order to access the premium tax credits in the marketplace. Another important SEP is moving out of the Medicaid coverage gap. These are folks who were previously ineligible for Medicaid because their state did not expand, and then their income increases to a level above the 100% of poverty line, creating eligibility for a premium tax credit. And this is a example of an SEP that requires folks to call the call center. Okay, Kyle, can you advance the slide? Sorry, I can't see the one important wrinkle to note, in case you are not aware of it yet, there is kind of a de facto extension for SEPs in some cases because of the pandemic, and this is available in healthcare.gov states. So people who miss their 60-day SEP window may still be able to get time to enroll in a marketplace plan because there is an SEP for disaster declarations. As we understand it, all states currently have a FEMA designated emergency in place. There is a link here on the slide where you can check that over time to see if that's still the case going forward. But if that is the case, and someone qualified for an SEP that already exists, a triggering event that already exists, but they missed their deadline because they were impacted by the COVID-19 emergency, then they could be eligible for an additional SEP. If they were, for example, sick with COVID-19, taking care of someone who was sick, or potentially if they've suffered or been affected by other effects of the COVID-19 pandemic, it's worth finding out if they might be able to get more time to enroll in that SEP. And this is an SEP that you would need to call the call center, the marketplace call center, in order to apply. And if the person is eligible, they would have up to 60 days from the end of the FEMA designated incident period to finish their marketplace enrollment. So that could be very helpful in giving people extra time. Next slide, please. So many of you are already familiar with the process of applying for SEPs. Many of them can be accessed on the website using the application that Tara was walking you through. Currently, it's important to note that healthcare.gov is providing flexibility around submitting documents to prove eligibility for SEPs, recognizing that consumers are having challenges during the public health emergency. So applicants at healthcare.gov can attest to the information that they provide on their application, including the events that trigger an SEP. If people have paper documents, they can hang on to them, keep them in their files potentially for future reference. But if they don't have paper documents showing things like whether the fact that they had lost employer coverage, you know, a piece of paper showing that, or the fact that their plan was terminated, they should still go ahead and apply for an SEP. They may not need those documents. If a client is asked for documents but doesn't have them, we included the link here that's just useful to kind of keep bookmarked, which is this explanation letter that healthcare.gov has created to help provide a reason for why documents are not available. And next slide, please. So important reminders, because we've just been talking about SEPs for marketplace coverage. Of course, eligible people can enroll anytime in Medicaid or the Children's Health Insurance Program. They do not need an SEP to get into those programs. And people without any current income for the month are most likely going to be eligible for Medicaid. So that is an important door to remember that it's there. Again, healthcare.gov does not have an emergency SEP just for COVID-19, like we have seen in some other states, and like we thought we might get through healthcare.gov. It's not there right now, so you really do have to look to the existing triggers for special enrollment periods to see what a client might be able to access. And the link here on the little screen capture, you can see that those are that's a resource. That's our Beyond the Basics reference chart on SEPs. So there's a number of different situations that trigger SEPs beyond those that I mentioned just now. And you should definitely consult this chart to kind of see if the person that you're speaking with might fit one of these situations. And it also provides other details like when coverage becomes effective that can be very useful. Next slide, please. So let's take a couple minutes to talk about COBRA. There are a number of people asking questions about this right now and confronting COBRA offers. Next slide, please. And there's some important, it's kind of an important decision point when someone loses their job-based coverage to decide whether they should go into COBRA, whether they should go into a marketplace plan. So it's important to kind of be aware of the different details. So when a person is offered COBRA, which if anybody isn't familiar with it, it is just a continuation of employer coverage that's federally required, mainly for businesses with over 20 workers. But so people losing jobs at large employers are going to be offered COBRA if they've had a health insurance through their job. But they can always choose marketplace coverage instead if they're otherwise eligible. And there may be some good reasons for them to consider doing that instead of COBRA. We're going to talk through that. The fact that they're offered COBRA does not prevent the person from receiving premium tax credits. You know, as you know, an offer of employer-based coverage generally does if it's affordable and comprehensive, but the COBRA offer does not bar the person from getting premium tax credits. If the person has enrolled in COBRA, they cannot change their mind and move to the marketplace once their 60-day marketplace SEP has ended. So the choice of COBRA and then running out the clock on the 60-day marketplace SEP means that person basically has to stay in COBRA and basically wait until the marketplace open enrollment period, most likely, in order to get into the marketplace. So it's an important decision to make carefully. The person can choose, however, to switch out of COBRA. So if somebody's gotten into COBRA and they've made a mistake, they want to change their mind, if they're still within their 60-day marketplace SEP window, for example, they've lost coverage within 60 days of coming to you, and they could decide to switch out of COBRA and get into the marketplace. So there is that flexibility. As long as the SEP is open in that period, they can make that different choice. The same would be true if they're in COBRA and they qualify for a different SEP. You know, if someone has a baby, if they're moving, those kinds of things, that could be an opportunity to get into the marketplace. Or of course, as I said, if it's the annual open enrollment period, anybody who has COBRA is free to move about the cabin at that time. And then, so the bottom line, I think, for COBRA is that when someone loses job-based coverage, that is an important moment to take a close look at the marketplace plans, but also it may not be as short of a time period as people fear. So if someone's coming to you a month or two after they've gotten into COBRA and they're finding it too expensive, they may still have the ability, because they're within that SEP window, to make a different choice. And Kyle, could you advance it, please? So here's just an example to kind of drive this point home between a COBRA and a marketplace plan. This is the Rivera family. They have coverage. They have had coverage from Lynn's employer health plan for their whole family. But she has unfortunately lost her job as a billing specialist in a healthcare system. And the family's income is going to be falling for the year from $100,000 to $50,000, and they're losing her employer plan. She does have an offer of COBRA for herself and her family, and that's offer 1 in the blue box that you can see there. The cost for the family would be $1,800 a month, and this is sort of an average, kind of a representative example of what someone might pay, because when someone has COBRA, they're going to have to pay the full premium plus an small administrative fee. So it is significant cost. They're having to pay that full cost themselves without the help of an employer contribution. In that case, if she wants to take that offer, she should elect within 60 days of receiving her election notice, the notice that she can get COBRA. And then there's a new rule that the 60-day clock begins after the end of the national emergency. So again, that's an example. There is quite a bit of time for people to elect COBRA, but the downside of COBRA for many people is that it may be too costly. Offer 2 on the right-hand side, the other blue box, you can see the marketplace offer for the Rivera family would be much more affordable because they're going to qualify for premium tax credits plus cost sharing reductions in the marketplace. So their net premium is going to be $259 a month for the whole family compared to $1,800 a month, just in this example. And in this case, they can clearly use that loss of qualifying coverage or loss of MEC, SEP in order to enroll in the marketplace. And they're going to have, the way that one works, they're going to have 60 days before she loses her job-based plan and 60 days after she loses her job-based plan to actually enroll in the plan and make sure that they can get into the marketplace. So that, I think affordability is probably the huge issue for most people with COBRA. Lots of people just cannot afford that much, and they should be connecting with the marketplace for that possible tax credit if they're going to be eligible for it. It might make it possible for them to keep coverage. And next slide. And I think with that, I'll turn it back over to Ina to talk about taking questions.
Great. Thank you so much, Sarah and Tara. So as a reminder, all participants are currently muted and in listen-only mode. If you'd like to ask a question, click on the Q&A icon and type your question into the box. So we'll start taking questions now. The first question we have is regarding the emergency declaration SEP extension. Can the extended SEP window for emergency declaration be requested even if the individual started COBRA and is enrolled in COBRA beyond the 60-day window?
I think it would be worth maybe making the call. I don't think we can say for certain what would happen in that situation, but go ahead and make the call. I think, you know, it's one of those that's sort of up to the discretion of the people making the decisions. And so it would be worth a try.
Next question is for Tara. What's the best way to resolve a problem with healthcare.gov not calculating UI correctly?
Well, the best way, if you know it's not calculating correctly, then you would probably have to call the call center and work it through them. I don't really know what other alternative we have, unfortunately, but I think that what we wanted to get across today was that what you see on the screen isn't necessarily what is the input for the Medicaid determination in particular, because we've gotten some questions about that, and it's a very reasonable question to ask. So, you know, always look at the EDN, the eligibility determination notice, to make sure that you know what was really used to calculate determinations based on, and then call the call center if you have other concerns.
Great. The next question is regarding income changes for Tara. If an individual has a zero income for 3 months but intends on going back to work after that 3-month period, should they call the marketplace and report that zero income?
So if the person is already enrolled in marketplace coverage, and then they have a period where they have no income, and then they plan to go back to work. Well, let's think about what would happen if someone does that. So, and let's also think, like, is someone really going to have no income right now when so many people are eligible for unemployment? I think it's less likely that people will have zero income. But if someone does, just think through the consequences. If someone is in a state where there is there's the Medicaid expansion, then they may be able to get into Medicaid if they have if they have a month where they have no income. If they're in a state without the Medicaid expansion, then having no income may mean that they are determined ineligible for Medicaid, but might still be eligible for PTC if they have annual income that remains above the poverty line. So I think it's always a good practice to report. It's technically required to report. I don't know how much it changes your results to report. It really depends highly on your circumstances.
A few assisters have reported that they enter UI income as yearly, so one-time payment. Is that okay to continue doing, or will it conflict with the marketplace calculations for Medicaid eligibility?
Yeah, it sounds, based on what we've heard about how the marketplace is calculating income, that's not the way to go if you have someone who's potentially eligible for Medicaid, because if you enter the unemployment as a lump sum, so if you enter it as a one-time payment and you just like calculate out, okay, what was it going to be for the year, and enter it as a one-time payment, it's not going to subtract out the $600 a week UI because it doesn't know for how many weeks to do it. And so if someone is sort of on the cusp of being Medicaid eligible, they're not going to get an accurate determination, even just because of the way the system is working. So it's really best to enter it on a weekly basis or on a monthly basis.
If an individual decides that they want to wait until after the end of the pandemic and then enroll in COBRA, would they owe for all of the months from the time their job coverage ended as well? I believe they're referring to owing premiums for COBRA. Sorry, I think that was for Sarah.
Sorry. If they need to take it, I think they have, I don't know for sure, actually. Tara, do you want to take that one?
Well, I think that the new guidance that the Department of Labor has put out has a lot of questions in it. And so we don't have all the answers about what happens if you extend the clock on your COBRA offer. It's really clear, though, that whenever if you want benefits to be paid, you have to have paid a premium. So if you wait to enroll and you want anything to be covered in that time period, then you're going to need to have paid the premiums for that time period. I think that that's as much as we can say, just because the DOL guidance is really new and I think untested, and I think that from what I've heard, employers have a lot of problems with it. So we'll see what happens with it in the next stage.
This next question is for Tara. With Medicaid not counting the $600 and Marketplace counting it, is it possible that in some states a person might be eligible for both Medicaid and APTCs? And how is that handled by healthcare.gov?
The Medicaid determination is always made first. So if someone is determined eligible for Medicaid, they are eligible for Medicaid. And you don't move forward and do the PTC eligibility calculation. So that's how that would be handled. And it's also worth noting, and Judy might want to jump in and say more about this here at this point, that there is right now a maintenance of effort requirement. And if someone is determined eligible for Medicaid, they should be able to remain on Medicaid even if they have, even if their circumstances change during the public health emergency.
Yeah, I'm not sure I have much to add. I think you said it, Tara, that anybody that was receiving Medicaid as of March 18th, the date that Families First was enacted, or becomes eligible for Medicaid subsequent to that date will remain eligible until the end of the public health emergency under the MOE requirement attached to the temporary increase in federal funds for Medicaid.
Great. And another question about using yearly income for unemployment. If an individual enters that the UI is being received weekly, the application calculates it at 52 weeks, and that might place the client outside of affordable health coverage. How should that be handled?
You fix it by fixing the annual income. So, so remember, they're sort of two distinct types of questions. There's the question where you're entering, what is your current monthly income? And that you need to make as accurate as possible because that's how the Medicaid determination is made. But then there's a separate question about your annual income. And that's really for APTC eligibility purposes. And these two don't need to match. So you could have, you should adjust the annual income to make that your actual annual income. But you should also make sure that your current monthly income is your current monthly income. So you would adjust for the unemployment, the overcounting of unemployment when you look at the annual income. You would adjust it there and not try to jerry-rig the monthly income. That should be your actual monthly income.
And some of the sisters have been entering unemployment as two separate sources of income, one for state unemployment and one for the extra $600 pandemic unemployment. Should they go back to the applications and change these calculations?
Ooh, I don't know. I mean, so I always start with the assumption that computers are stupid and that they're only going to do math based on what we tell them. And so if you tell them that Jane had a $600 payment and she had a $375 payment for the month, then what I fear is that there might be two subtractions there, subtracting $600 twice. I don't know. I don't know that the computer is going to like that. So I think that the best advice we've gotten from the marketplace is to just enter it as people have received it and let the marketplace do the math on the subtracting of the $600. So what you don't want to do is you don't want to do the subtraction yourself, because then you're putting in an inaccurate amount of UI. So you want to make it, you want to make sure that you're entering the full amount of UI so the system can do its work behind the scenes.
If an individual is eligible for Medicaid but is in a non-expansion state, the UI income for them would put them under 100% of the poverty level, but the marketplace would have them at 140% with the extra $600. How should that situation be handled?
Well, if I'm understanding the scenario correctly, then the calculation is just going to handle it. So since the calculations are done sequentially, right? So we always look at Medicaid eligibility first. If the person's not eligible for Medicaid, then you look at APTC eligibility. And in this case, if you're in a non-expansion state and someone is determined not eligible for Medicaid because of that subtraction of the $600 or for any other income reason, if they're not eligible for Medicaid, then they'll do the APTC determination. You add that $600 a week and bam, someone's eligible for APTC where they might not have been before. And so there's not really a conflict there. You're just going to do these, the system does this sequentially. You can think about it sequentially. If there's no Medicaid eligibility, you can move on and try and determine if there's APTC eligibility. And some people are going to find that they are getting a higher UI benefit than they had in wages. or certainly a higher UI benefit now than they would have had before. So it can make the difference and really move the dial for some people to help them get out of the coverage gap, in which case it's really important to keep in mind the advice that Sarah gave on the SEP for moving out of the coverage gap to make sure that you can take advantage of that income swing.
What is the recommendation on calculating UI and income for lawfully present individuals who are in the 5-year bar and who are not Medicaid eligible?
I don't think there's any difference in how you would do it. You would just do it the same way that unless that person wants to write in and like with some more specific concern about how you would, like a more specific question about this. There's no special rule. There's nothing special that I can think of. I think you would just calculate the income the way you normally would.
Great. Let's see. And the next question is regarding the UI benefits. What is the maximum possible weeks of the extra $600 in UI benefits?
I believe the maximum possible weeks, I think it was 17. It's benefits up until the end of July. And so based on when the legislation was passed to the end of July, that's where I get the 17. But it's not as though if you start May 1st, then you get 17, or you start June 1st, then you get 17. It's not that. It's however many weeks you have benefits up until the end of July. That's when the $600 per week stops. Currently, of course, there might be legislation that changes that, and then we'll deal with that when it happens. But you really shouldn't think of it as a number of weeks. You should think of it more as it continues in this case until the end of July.
In the situation where someone is getting regular state unemployment, but not the extra $600, will the system know not to subtract $600 from their income?
Well, right now, I believe it's the case that everyone who's getting unemployment, state unemployment is getting the $600. I don't know what exceptions there might be. I didn't think that there were any exceptions right now. I can say that after the marketplace, the agency is really well aware of how complicated the UI calculation is. And so I'm sure that they will be changing the math in the system after July 30th or after the end of July, just to make sure that it's no longer doing that kind of subtraction. So for now, I think that you can just enter the income as it is.
We have a question for Sarah to clarify. Is healthcare.gov not requesting SEP documentation at this time?
So our understanding actually from assisters is that they're not being asked for documentation. CMS hasn't put out any official rule on this or set it in black and white in a way that we can hang our hats on. But I think that yes, you should proceed, apply for SEPs that people are eligible for and attest to that. And you are, as we understand it, not going to be getting a request for documentation.
Let's see here. And just as a reminder, you can ask questions by clicking on the Q&A icon at the bottom of the screen and typing your questions into the box. So just to clarify one more time, Tara, a sister should enter the extra $600 into the marketplace application, and the marketplace application will remove it when they're determining APTC. Is that correct?
That's what we've been told. But like I said, so that's what we've been told. That's what the marketplace has been working on doing, doing that subtraction behind the scenes. Now, if you, but what you should always do is check the EDN. So check your eligibility determination notice at the end of the process. Yes, it's at the end of the process. You don't get it before. So You can't like stop and go back, but check that EDN and just make sure that everything flowed through correctly. Make sure your Medicaid, your current monthly income on which Medicaid is, the Medicaid determination is made is correct, and make sure your annual income is correct.
And when is one of the extra UI payments scheduled to end?
The extra $600 a week is right now scheduled to end at the end of July. But those other federal extensions, so to new populations and for extra weeks, those generally end at the end of the year. And again, you know, that's all right now. It's certainly possible that legislation will extend any of those benefits. And so we'll get back to you if that happens.
Great. So that's all the questions that we have at the moment. We'll give people a couple more minutes to answer or to ask questions. I see that somebody raised their hand. So if you'd like to ask your question out loud, I can unmute you. Let's see. I believe that was Nancy. Nancy, you're unmuted. You're welcome to ask a question out loud. Nancy Bennett. Oh, let's try this one more time. Oh, I think you have to unmute yourself, Nancy. You might be muted on your side. Okay, we'll come back to Nancy. So another question came in. If someone chooses their COBRA offer and they are still within the 60-day window for loss of coverage, can they get into the marketplace?
Yes, if they're still in their marketplace SEP window, they are eligible to access their marketplace coverage. It doesn't close at the moment that the COBRA has been chosen. The clock continues to run, and their 60 days is their 60 days. So the questions in the application could be a bit confusing around this. So we're going to take a look at that, but that is the rule. So people should be able to get in the marketplace if they're still within that time frame.
Let's see. For clients currently on the marketplace who want to stay in the marketplace and not move to Medicaid while receiving unemployment benefits, should they update their application, or is it better to now change the marketplace application?
I think it depends a lot on the circumstances. Remember that there is that when people attest in their application, one of the things they're attesting to is that they'll update changes, I believe. And so, bear that in mind. On the other hand, there are so many changes in income right now. I don't think that anyone expects you to run to your computer every 2 weeks with updates in your projections, which might be incredibly reasonable given that the amount of uncertainty people have. People have optimism and then less optimism about their prospects for finding employment, for instance. So I think it's hard for me to give a general answer to that, except to remind people that there is an obligation to report. On the other hand, no one expects you to report every single little thing just because of the uncertainty that we have right now.
And just to clarify, when you say attest to your SEP on the application, does that mean just signing it, or is there something separate the applicant should do if they're not submitting SEP documentation?
I think we're referring to just it's built into the application. When you are submitting it, you're attesting it to it. There may be a checkbox to actually do it, but it's something you're already being asked to do. It's just that's how you're verifying the SEP.
Great. And we have another person who raised their hand. Carlos, I'm unmuting you. You'll need to unmute yourself on your end, and then you're free to ask your question. Carlos Avila? Sorry if I'm mispronouncing your name. Oh, looks like you're unmuted, so go ahead. Carlos, if you're speaking, we can't hear you. So you might need to speak up or just make sure you're not muted. If you're speaking, we still can't hear you. So maybe you can type your question into the chat box, into the Q&A box. Just give Carlos a minute. We did have another question come in. So to clarify, do new enrollments with reported zero income need to submit SEP documents?
So new enrollments through healthcare.gov would need to have an SEP associated with their enrollment. If you couldn't just get in with a new enrollment unless you had met one of the characteristics, you know, and like losing other coverage or the other triggers for special enrollment. But in terms of submitting documents at this time, our understanding is that people are not consistently being asked for documents. So if they apply, they've experienced those events and they attest to that on their application, they should be getting marketplace coverage.
But if I'm understanding the question correctly, if someone has zero income, then they don't need an SEP because they can come in and be determined eligible for Medicaid. And so the system would recognize based on their income that they don't need to qualify for some other SEP. If they're coming in and they're presenting with zero monthly income, then they wouldn't need to qualify for any kind of SEP to come in even through healthcare.gov. They can be determined eligible for Medicaid without that at any point.
Yeah, sorry about that. Absolutely. You do not need an SEP for Medicaid.
If the eligibility determination notice does not correctly reflect the monthly and annual income the consumer expects, do you advise that the individual goes back into the application and changes their income?
I don't know what the most expeditious way to do that is right now, if it's to go back into the application or to call the call center. I don't know what the best way to go about that right now is. People probably have strong opinions on it, I guess, which is maybe why I don't want to weigh in, because a lot of people have strong opinions about whether they should go back into the app versus calling the call center. I would personally probably go back into the app and make that adjustment if I'm clear what adjustment I need to make. But if something just doesn't seem to be working correctly, then it might be that I need to call the call center just because I don't know what change to make.
Sarah, is a COBRA offer considered an offer of employer coverage? On the application, there are several additional questions regarding affordability if someone has an offer of employer coverage.
So a COBRA offer so when we're talking about the reason an offer of employer coverage is significant is because if you have one, then you might not be eligible for premium tax credits. For purposes of COBRA, that is not considered, for PTC, COBRA is not considered an offer in that sense. So person has the same right to access a premium tax credit as anybody else.
And if an individual encounters issues with the marketplace not allowing them to enroll with a 60-day SEP if they're enrolled in COBRA, how should they resolve that?
I'm not totally sure. I mean, my preference would be to go into the application and try to deal with it there. If that doesn't work, I think you would have to elevate it to the call center. And I know that someone asked a question about documentation of this policy, and so we can try to pull that together. that when the SEP window is open, the SEP window is open and people can adjust and come into the marketplace during that time. So I think that might be helpful, because if you call the call center and you had that documentation, that might be what you need to say in order to break through if there's any kind of issue with that.
And in a Medicaid expansion state where an individual has no current monthly income, but their annual income is expected to be 138% of the poverty level due to past earnings and anticipated future earnings, would they go to Medicaid or the marketplace?
Well, remember that when we, like I said before, when you're in healthcare.gov, and I think this is true with state-based marketplace applications as well, they're looking at two sort of macro pieces of income information. They're looking at your current monthly income, and then they're looking at your annual income. And the current monthly income is what they're looking at first, and that's going to make the determination of whether you're Medicaid eligible or not. And then only if you're not Medicaid eligible will they consider you for APTC eligibility based on annual income. So, so just keep in mind that those are different things, and that the annual that the determination will be made based on your current monthly income. So if someone comes in with zero dollars in current monthly income, it doesn't matter sort of what they had at the beginning of the year or what they anticipate their final annual income might be. What matters is the current month. And so that's the basis for the Medicaid determination.
Great. Well, thank you so much, Sarah and Tara. As a reminder, we'll be distributing the materials from today's town hall via email. And if you have any questions or need assistance, please email us at our Beyond the Basics contact email, beyondthebasics@cbpp.org. And with that, we'll bring this town hall to a close. Thank you again for joining us today.